Hi, everyone. Good afternoon and welcome. This is the second part of our three-part Advanced Health Law series. I'm Amy Fouts, the chair of the Health Law section and a partner at Baker Hostetler. We have a great program lined up for you today. We're going to focus on healthcare transactions in the midst of the pandemic and what that means for providers. We ended up combining our hospital and post-acute care panel together because a lot of the issues that they're seeing overlap. We will then move on to physician and physician practices. And as time permits, we will have a moderated Q&A with our panelists and Wade Miller. Today, you will receive 2 CLE credits, 1 regular and 1 professionalism. Our panelists will focus on professionalism throughout their panels, and we will end today with Kenyatta McCleary Holder, who has a great presentation on professionalism, diversity, and inclusion. Thank you to those who joined us last week. We also have next week, same time, Wednesday from 12 to 2, where we will have our fraud and abuse panel, which will be hosted by Bob Brennan and Aaron Danzig. They are going to cover the CARES Act funding and the enforcement actions that have started or are likely in the pipeline for the billions of dollars that have been pumped into the healthcare system. A few housekeeping items before we get started. Please keep your microphones on mute and your video off. The chat function is working. It will go to our moderator, Lane Sosby, with the bar. So if you have any problems or issues, please reach out to Lane. And also if you have any questions, if you want to submit those through the chat function as well, during our Q&A, we'll try to get to those questions. The materials from today's presentation will be sent to the email address that you registered with. So those materials will be forthcoming. Before we get started, I wanted to say thank you to Mary Jo and Lane from the bar for helping us put this together. I'd also like to thank the executive committee, in particular Rebecca and Wade, who helped put this together. And last but not least, to our speakers. I said this last week, I'll say it again. We all have a lot going on. For a lot of us, our lives have been turned upside down, and I really appreciate our speakers putting this together and keeping up with the day-to-day changes that are going on and presenting to you today. So thank you. With that, I'm going to introduce you to your 2 hosts. First is Rebecca Merrill, who is the vice chair of the executive committee. She is a partner at Denton's in the life sciences and healthcare practice. Rebecca's experience includes advising healthcare providers and life science organizations in the area of business strategy and transactions, fraud and abuse, regulatory compliance, and privacy and confidentiality. She routinely counsels healthcare providers on corporate matters such as contracting, employment, and corporate governance, and issues dealing with regulatory compliance, including HIPAA, Stark, and the anti-kickback statute. Rebecca received her JD from Suffolk University Law School. Next, we have Wade Miller, who also serves on the executive committee and is an advisory board member to our new mentorship program. Wade is a partner in Austin & Bird's Atlanta office, where she focuses her practice on healthcare litigation and regulatory compliance. Wade represents a broad array of healthcare providers, including national hospital chains, medical device companies, health plans, nursing homes, home health, and hospice providers. She represents clients involved in civil False Claims Act actions, government investigations, and whistleblower actions. She is routinely involved in conducting internal investigations and advising clients on making voluntary self-disclosures. Wade received her JD from the University of Virginia. Rebecca and Wade, thank you, and I turn it over to you.
Excellent. Thank you so much, Amy, and thank you everyone for joining us. A special thank you to our speakers who I have the privilege of introducing today. And in the interest of getting them started, I will begin introductions now. So with respect to the hospital and post-acute panel discussion this afternoon, we have 4 speakers. Rob Stone has joined us, and Rob is the head of Alston & Bird's healthcare regulatory practice. He focuses exclusively on healthcare compliance and regulatory matters with a particular emphasis on fraud and abuse and reimbursement reform, as well as regulatory diligence. He has counseled a wide range of healthcare clients, including national healthcare systems, physician practices, academic medical centers, and others. Rob is a regular presenter at national and regional conferences, including multiple presentations with AHLA, the Institute on Medicare and Medicaid Payment Issues, and Hospitals and Health Systems Law Institute. Rob received his JD from Vanderbilt University Law School. Prior to law school, he practiced as a licensed mental health counselor in Florida. Thank you, Rob, for joining us. We also have Summer Martin. Summer is a partner with Denton's healthcare practice, focusing on health reform and regulatory compliance. Her national practice includes representing organizations within the healthcare industry on a variety of transactional and regulatory matters.